Good afternoon, and thank you to Dr. DiBertagnoli and the whole planning committee for including me in this very exciting workshop. My name is Kevin Tang, and I am going to discuss the inclusion of older adults in the development program for a drug called Tacitaxel. Tacitaxel is at the end of phase 3 development, and the sponsor plans to submit an NDA this year to the FDA for the treatment of metastatic breast cancer. Here are my disclosures. As this audience knows, when we look at developing drugs for cancer, we often focus on things like tumor type, molecular target, or line of therapy. And unfortunately, we often overlook special populations with particular unmet medical need, and this includes older adults. And this is indeed unfortunate because this population is in fact quite prevalent. Here you can see in metastatic breast cancer, fully 50% of patients are 65 or older. Now, when treating these patients, it's important to focus on a balance of efficacy, tolerability, and quality of life. The current approved treatments for metastatic breast cancer are shown here, and you can see that the most commonly used choices are the taxanes on the right side of the pie chart and capecitabine on the bottom of the pie chart. The taxanes are proven to be effective at treating metastatic breast cancer, but unfortunately, they all require intravenous infusion as their delivery mode. Capecitabine, on the other hand, is administered orally and can be taken at home. Unfortunately, however, the pill burden with this agent is quite high, with the average patient typically requiring more than 100 pills in a 21-day cycle. Now, Tacitaxel, an investigational agent, belongs to the taxane class. And here you can see a comparison to the approved taxanes in the middle of the slide, paclitaxel and docetaxel, and then we show Tacitaxel on the far right. And what you can see is that this is the first of the taxanes to be orally bioavailable. It also has a significantly longer plasma half-life at 8 days compared to the approved taxanes with half-lives about half of 1 day. And what this means to the patient can be very simply shown here. The dosing schedule for Tacitaxel is it is given orally once every 3 weeks, and the entire pill burden, because Tacitaxel is quite potent, is only 2 to 5 capsules for each dosing event. So you end up having a Q3 weekly regimen that involves only taking a small number of pills on that frequency. Now, I'm going to briefly summarize 3 clinical studies that we believe are pertinent to today's subject. The first is a phase 2 study led by Dr. Andy Seidman at Memorial Sloan Kettering. This was a multi-center study looking at Tacitaxel given as a monotherapy in patients with metastatic breast cancer. And in this study, the confirmed response rate was 45%. And when looking at that response rate by age group, you can see on the left in the box there, about 29% of the patients were 65 and older, and the response rate was very high in this subset, which gave us the initial idea to perhaps focus more and certainly include this important patient group in our development plan. So this slide shows our phase 3 study. These results were just recently presented at the San Antonio Breast Cancer Conference this past December by Dr. Joyce O'Shaughnessy from Texas Oncology. This study was a randomized controlled study comparing capecitabine alone to a reduced dose of capecitabine plus tacitaxel, again given only once every 3 weeks as an oral capsule. And as you can see on the left, one of the key eligibility criteria was adults with metastatic breast cancer of any age with no upper limit on how old they were. And the study met its primary endpoint by showing a significant improvement in progression-free survival. And again, when looking at efficacy by age group in the boxed area here, you can see in this study, 22% of patients were 65 or older, and you can see that the efficacy was very consistent with the older group as compared to the younger group if you look at the hazard ratios on the right of the slide. Now, importantly, in terms of adverse events of interest, and many of these pertain or are very pertinent for the older population, the rate of grade 3 or higher neuropathy and the rate of grade 2 alopecia or hair loss were both low and in the single digits, and there were no cases of treatment-related hypersensitivity reactions. Now, when looking at what features we employed to increase the enrollment of older adults in this study, these are summarized here. Of course, because our drug is given orally, it is possible to administer it at home. Furthermore, that then enabled us to minimize clinic visits by enabling telemedicine and or local lab assessments. But third, and very importantly, about half of the patients in this 685 patient study came from or were treated at community oncology sites. And what we found, as you can see in the bar chart below, is on average, the patients from the community sites were older than the patients from the academic sites. Now, we took that one step further, and this is the third study I want to briefly summarize. And we decided to do a specific cohort that exclusively focused on older adults. And that is cohort 2 of Contessa Trio on the top box on the left here. So this cohort enrolled patients only if they were 65 years or older, and these patients received tacitaxel monotherapy, again, on a once every 3 week oral schedule. And you can see here, this study just recently completed enrollment, and we were able to enroll 69 patients with a median age of 72. And you can see the distribution in the bar chart here. So in summary, older adults often represent an overlooked population in the development of cancer drugs. In our target indication, which is metastatic breast cancer, this population represents fully 50% of patients. And we developed tezacaftor in a way to be able to provide evidence of its benefit risk profile in this population. Some of the strategies we employed to increase enrollment of older adults in our studies include the at-home administration of our drug and also inclusion of community oncology sites in our studies. With that, I want to thank you for your attention, and I look forward to your questions during the panel. Thank you.